Hello and welcome to the Integrated Rehab and Performance Podcast. My name is Dr. Nick Curtis and I'm running the show here at the Integrated Rehab and Performance Center. Today we have another golf podcast. We are talking about TPI's cervical rotation test. This is a test, or kind of a screen really, to assess do we have the required appropriate cervical or neck rotation and lateral flexion or side bend to achieve golf positions. Now, I know what you're thinking. There's usually not a lot of neck action in the golf swing that you would think. But if we take a closer look, say we're setting up at the ball and we go into our backswing, what is rotating? We have our trunk rotating, our pelvis rotating, and then our hips are rotating. Everything rotating underneath us while our head is staying stable looking down at the ball. Right? Our head angle doesn't change. The rotation doesn't seem to change, but it actually is. The trunk, again, is rotating underneath the head. It's the same thing as keeping a stable trunk and rotating the head on the trunk. So we are getting cervical rotation in the backswing, downswing, and everything in between. So we need to make sure that we have that range to, again, we just test it in a way where we're just rotating at the neck. That is the key behind the cervical rotation test, is appreciating that the cervical rotation actually is extremely important. Imagine what would happen if we're having issues keeping our head steady on that ball. You can imagine the visual issues, as well as just the timing, the ability to keep your posture and positioning where you need it to if our head and neck is starting to get pulled in positions that we're not intending to put it in, right? And then when it comes to the rehab or the pain potential, right, the injury potential down the line, this is a key thing to look at to make sure that we are not going to run into issues down the line with head and neck pain or upper back pain. And if we are dealing with some disc issues, whether it was golf related originally or not, but it is bothering us on the golf course or after a round or before a round, whatever it might be, again, this is a key thing to look at. Do we have that mobility there in the neck? And a lot of times it can be missing, especially in patients that are dealing with pain already. So it's an important screen. If we do notice that there's something up, right, we're not getting that rotation, then we need to take a deep dive look into all the different reasons for why that might be true and how we need to go about addressing it, because depending on what the issue is, changes how we address it. So that is the topic for today, the cervical rotation test. Okay, so the cervical rotation test for golfers. It's a simple test. We have you standing there, arms at your side, feet together. All you're going to do, rotate your head as far as you can in one direction, keeping a stable trunk underneath you, and then go as far as you can. We're looking to make sure that chin crosses over that mid-clavicle area. So that's that collarbone. We want that chin to make it that far. It's about 80 degrees of rotation, and then we even test to see, can you flex in this position to get your chin down and to actually touch that collarbone. Again, assessing for full mobility there. If we can't get to that range, we can't get that chin down, again, getting your chin down without opening your mouth or anything like that, then we know, okay, we need to take a closer look. There's lots of things that we can look at. Is it an upper cervical mobility issue, a lower cervical mobility issue? Is it a muscular mobility issue? Is there pain associated with this? Is that coming from a disc? Is it the facets? Is it the muscles? Are the muscles tight because of an issue with stability, so that it is a brain protective mechanism that is creating that tension in the muscle? Is it just from chronic posture? Is it because the deeper muscles haven't been doing their job of creating the stability, so that the superficial muscles now are doing that job, and because of that are not doing their role of creating mobility, right? Creating movement. Instead, they're creating stability, the opposite of movement. So, right, we need to get to the bottom of all those different things. Is it osseous? Is it not? Can it be changed quickly? Does it need more time? All those sort of things. So the screen tells us, hey, we need to take a deep dive. So after that, significance of the cervical rotation test in the golf swing. Again, as you start that backswing, your trunk is moving underneath you. It means that your head is staying straight, but we need the segments in the neck are actually rotating, flexing, laterally bending, things like that. So the muscles are lengthening and shortening in different areas. You're getting cervical mobility as you do that. It's essential to keep a position, especially optically with the eyes, that you can maintain that good position and unmoving position so that your body has better awareness of what's going on everywhere else. Really key there. When our head and neck start getting messed up and start messes with our eyes and our plane to the horizon and keeping our visual cues or references to the horizon, and that starts getting messed up, any sort of proprioceptive issue can start arising from that. Now, what else is an issue with this? It's not just the proprioceptive or optical, but also, or the pain and the potential injury. But performance-wise, if we can't get into that backswing because our head and neck starts rotating with our trunk below us, now you notice that that wouldn't really happen. Instead, the golfer would compensate, right? So if you start noticing that your head's getting dragged and you have to start looking, maybe if you're a righty in the backswing and then your head starts rotating right with your trunk and you have to start dragging your eye or looking to your left with your eyes, you'd certainly notice that pretty quickly. And you know that's wrong. Your body wouldn't let that happen. The proprioceptive things the body's going to protect first. So we compensate elsewhere. You're going to start extending at the hips, right? You're not going to be rotating as much anymore, and you're going to do what feels like getting further into that backswing by doing other things, standing up, extending the knees a little bit, pushing yourself forward, changing your spine angle below it, right? So now you're using your lumbar spine and thoracic spine a little bit more. Anything to protect or maintain what feels like that normal head position, because that's kind of what gets prioritized, and all sorts of swing characteristics start to arise from that, things that maybe you've been working on for weeks, months, or years, and again, maybe it is not getting better because you haven't fixed or addressed a key mobility issue here being in your neck, if you haven't looked for it. So could be a key for a lot of people that are struggling to get long-term change with certain swing characteristics and things like that. So let's take a look at that cervical rotation test in action, just so you can get a visual of what we're talking about here. Okay, for this cervical rotation test, I want the camera on a side view, about shoulder height. And from here, with our feet together, we're going to rotate just at the neck as far as we can. And then we're going to tuck our chin and see if we can get our chin to touch our collarbone here. So we'll have Nick start. Feet are together. He's going to rotate as far as he can towards his right. And then he'll see if he can tuck that chin down to his collarbone. Okay. And we'll see any compensation where the shoulder might raise to get there. And then we'll flip, and we'll do the same thing on the other side. Feet are together. Rotating just at the neck. And then from here, seeing if he can tuck that chin to get his collarbone. So you might be thinking, what are the different reasons why we might be someone who's lost their cervical mobility in certain ways? Again, I mentioned a lot of the different reasons behind it. Could be arthritis, could be muscular tension, could be a change in how the muscles and their motor control over the neck, which could also come from trauma and different things like that. And there are many factors that go into how much neck rotation we can get. Thorough history is first and foremost most important to figure out is there a history of trauma, is there an osseous deformity or genetic variations in there, day-to-day living and posture, all this stuff plays a role, right? And we can attribute these different things, especially if it is a muscular thing, to tight superficial neck muscles being used to create stability instead of those deep neck muscles that are designed to create that stability. Now we're losing some of that function of those superficial muscles that are designed to rotate and create movement at the head because they're playing a role in stability. Again, if we've had trauma, car accidents, things like that, it could actually change that curvature of the spine a little bit. The bones could have impact to them that changes the curvature of the neck. And again, any sort of other bony arthritic osseous change where there's bony deposition, more bone being put down, or a bone that had flattened for whatever reason. Again, this changes the architecture there at the neck, and it certainly has an impact on our ability to rotate. Now we just have to answer the question, what are things that we can work on and what are things that we can't? If there's severe nerve pain in any patients going down maybe both arms, again, one arm we could probably work with. If it's going down both arms, we're having severe weakness that's progressing, things like that, then we need to get you into the right place for that. But otherwise, we have ability with chiropractic manipulative therapy, soft tissue therapy to get the ball rolling on a lot of this neck stuff, whether we're addressing that facets, kind of that, we can call it those bony issues where we get those cervical segments moving and rotating on top of each other again, opening those things up, and then we can use our hands again for the muscle issues to get any of the chronically tight muscles to start opening up. But again, if it was due to an issue in the underlying role that those muscles are playing, that we need to combine that with our corrective exercises and things like that. In fact, we have to combine all this stuff with corrective exercises and eventually performance exercises to get that transition and long-term change to that neck mobility and stability. Okay, so to conclude, quicker one here today. Again, when it comes to the next stuff, a lot of it's hands-on manual stuff, and then we progress into our corrective exercises and any sort of performance exercises, which again, the performance exercises look a lot like the other performance exercises. We're just now doing them with full access to cervical mobility, and we just might in some cases have to retrain that golfer to do things without those compensations that they were doing before, right? It's hard for them to realize that they're doing them. Now that we've trained in that new mobility and stability, we just have to get them to start doing things again and then stopping them from using those other compensations and forcing them in a way to start using their neck mobility like they have. So again, that's that performance side. Correctives really just working on getting the deep neck flexor working again, turning off the superficial muscles, and then creating strength and control into that neck after stage one, right before this, which was even that hands-on stuff, manipulation to the spinal segments, and then soft tissue work. So that's kind of a backwards way of how we do it, where we don't actually start performance, go back to hands-on. We start a hands-on, work into correctives, and then performance stuff. So again, a shorter episode here today, but that is the basis of the cervical mobility test from TPI, Titleist Performance Institute, and why it's important, what it looks for, how it shows up in the golf swing if we're missing some of these findings that can come from the screen, and how we go about kind of that theoretically, how we go about making these changes in the golfer. So thank you for listening. If you have any questions, feel free to reach out through the email. You can text the number on the website. Again, the website is www.integratedrpc.com, Integrated Rehab and Performance Center. Feel free to send a text to the number there or reach out via the section on the website there. Be happy to talk with you guys, answer any questions, or get you in for a free discovery visit where we just go over what you're dealing with, what your goals are, and how we might be able to help. Thanks for listening. Bye.